Hello everyone, welcome to the Smart RN channel. My name is Henry. In our video today, we are going to look at renal failure. Now, renal failure refers to the partial or complete failure of the kidneys to filter blood. The major function of our kidneys is blood filtration. Through this process, the kidneys remove waste products from our blood, and this results in the formation of urine. So, partial or complete loss of this blood filtration function by the kidneys is what we term as renal failure. Now, renal failure could result in a multi-system organ failure. When we are looking at the renal system, we said that failure by the renal system will also result in failure by other systems of the body. So that's why we're saying that when the kidneys fail to filter blood, then other organs of the body have a likelihood of also failing. Why? Because the waste products which are not removed from the blood could become detrimental to their performance. So renal failure results in multi-system organ failure. Renal failure is in the form of either acute kidney injury or chronic kidney failure. Renal failure is in the form of either acute kidney injury or chronic kidney failure. So let us start by looking at acute kidney injury. Acute kidney injury is at times abbreviated as AKI, and this refers to the acute and rapid loss of kidney function. When something happens acutely, it happens rapidly. It happens over a very short period of time, but the effects are normally very severe. So when our kidneys rapidly lose their filtration function, we term it as acute kidney injury. Now, on a positive note, acute kidney injury is reversible. We can be able to restore the kidneys back to their normal filtration function, especially when we address the causes of acute kidney injury. Now, if these causes are addressed in a timely manner, then we can reverse this acute kidney injury. But if the causes of acute kidney injury are not addressed in a timely manner, then acute kidney injury could progress to chronic kidney failure. So, what are the risk factors for acute kidney injury? Factor number one are hospitalized patients with acute illnesses. There are those patients who have suffered acute illnesses. And as we have said, acute illnesses are those that happen rapidly and over a short period of time. So these illnesses can also injure the kidneys of this particular patient. So those patients who have been hospitalized by acute illnesses have a likelihood of suffering acute kidney injury. Number two, we have sepsis. Sepsis is a very deadly condition, and this happens when our bodies abnormally respond to infection. When our bodies respond to infection, we normally have a cascade of events which result in inflammation. Many systems of the body or many organs of the body may end up being damaged, and one of them is the kidney. So the kidney could be injured as a result of sepsis, a very deadly condition that takes place when our bodies abnormally respond to infection. Then we also have cardiovascular disease. People with cardiovascular disease are predisposed to acute kidney injury. Remember, the heart pumps blood throughout the body, and by doing so, it helps to perfuse even our kidneys. So when this heart has got problems, when we have got cardiovascular disease, it interferes with the cardiac output, and interference with the cardiac output reduces perfusion to our kidneys. So our kidneys are likely to be injured in those patients who have got cardiovascular disease. We have got diabetes mellitus. Patients with diabetes have a likelihood of suffering AKI. Why? Because diabetes damages the nerves in our bodies. Elevated blood sugars in our bodies damage the nerves, and our kidneys are innervated by various nerves. So when we have this nerve damage in our bodies, then we have a likelihood of suffering acute kidney injury. The use of contrast media also puts our patients at risk for acute kidney injury. The use of contrast dye with imaging studies like CT scans or studies like MRI, they put our patients at risk for acute kidney injury. And that's why before contrast dye is used with these imaging studies, kidney performance is normally evaluated to assess the risks of using that contrast dye, because it is very easy for the contrast dye to injure our kidneys. Then we have got nephrotoxins. Nephrotoxins are those chemicals and medications which are very toxic to our kidneys. For example, we have got aminoglycoside antibiotics. They are very toxic to our kidneys. We have got antifungals like amphotericin B. It is very toxic to our kidneys. So the use of these chemicals and medications that are toxic to our kidneys could actually expose a patient to acute kidney injury. We have aging. The older we become, the more reduced our kidney function is. Our nephrons reduce in function as we grow older, and this is likely to put us at risk for acute kidney injury. Then we have got major surgeries. Those patients who are undergoing major surgical procedures could end up having acute kidney injury. For example, when we have heart surgery or cardiovascular surgery, we could interfere with the cardiac output, which will in turn interfere with the kidney perfusion and therefore injuring our kidneys. We have got those patients who are undergoing major abdominal surgery. We could cause trauma to our kidneys. We could physically injure our kidneys during the performance of that abdominal surgery. So those patients undergoing major surgical procedures have a likelihood of incurring acute kidney injury. So what are the causes of acute kidney injury? When a person suffers acute kidney injury, what are the causes? Now, we have divided the causes of acute kidney injury into three. We have got prerenal causes. Prerenal causes are those that happen before the kidneys. Then we have got intrarenal causes. Those are causes that happen within the kidney itself. And then we have got postrenal causes. Those are causes occurring after the kidneys. So to understand the causes of acute kidney injury, we look at them in terms of prerenal causes, intrarenal causes, and postrenal causes. Now, prerenal causes are those external factors that result in a reduced blood flow to the kidneys. They are those factors that cause a reduction in blood flow to the kidneys. And when these factors cause a reduction in blood flow to the kidneys, they actually interfere with the kidney perfusion. So the kidneys are not perfused very well. The kidneys require an adequate amount of blood and therefore oxygen to be able to perform their function. So those prerenal factors interfere with blood flow to the kidneys, resulting in a reduced blood flow. So what are some of those factors? Number one, we have got hypovolemia. When we have got reduced volume in our circulatory system. When we have reduced volume due to one reason or the other, for example, if we have dehydration, we are going to have reduced volume in our circulatory system. If we have got bleeding, if we got trauma and we bled profusely, then we are going to lose a lot of blood. That is going to interfere with our volume in the circulatory system. So reduced volume in the circulatory system is going to cause injury to our kidneys because they are not going to be perfused adequately. So hypovolemia is one of the prerenal causes. Number two, we have got decreased cardiac output. When that amount of blood that is pumped by the heart is reduced, then the kidneys are not going to be adequately perfused. So this could cause injury to our kidneys. Then we have got decreased blood pressure. Blood pressure is very important for perfusion of our kidneys. When the blood pressure becomes lower, then not enough blood is supplied to our kidneys. And as a result of this, our kidneys could easily be injured because of that reduction in blood pressure. And then we have got vascular obstruction. When the blood vessels supplying blood to the kidneys are obstructed, then there is reduced blood flow to the kidneys. And this results in what we refer to as acute kidney injury. So vascular obstruction is also a prerenal cause of acute kidney injury. All these prerenal causes normally result in a condition referred to as azotemia. Azotemia is a condition whereby we have got elevated levels of urea and other nitrogenous compounds in our blood. Why is this so? This is because our kidneys have been injured. They are not functioning well because of a reduction in this particular blood flow. So the reduction in blood flow to the kidneys results in a reduction of kidney perfusion. So azotemia is that condition that results when you've got elevated levels of urea and other nitrogenous compound in our blood. Now, normally, when we have these prerenal causes, there are compensatory mechanisms that the kidneys normally put in place to try and increase this particular blood flow to the kidneys. For example, the kidneys will release renin. And normally, when the kidney sense a reduction in perfusion, they interpret that as a drop in blood pressure. So what they do, they release renin, which is a hormone that helps to initiate what we refer to as the renin angiotensin aldosterone system. This is a system that helps to bump up blood pressure so that the kidneys are also perfused properly. Number two, they also try to conserve water and they conserve sodium. Remember, water follows sodium. So the kidneys are going to hold on to sodium so that they can hold that water and therefore increase volume that could bump up blood flow to the kidney. So during the prerenal conditions, the kidneys try to issue compensatory mechanism to try and overcome that. But when these prerenal compensatory mechanisms fail, then we have what we refer to as intrarenal causes. Now, intrarenal causes are those causes that result in damage to our kidneys and the nephrons. When our kidneys are damaged, when our nephrons are damaged, then our kidneys cannot perform their function properly. So this is referred to as acute kidney injury as a result of intrarenal causes. What are some of those causes? Number one, acute glomerulonephritis. Remember, the glomerulus is that part of the kidney that performs the actual filtration of blood. It is made up of a system of semi-permeable capillaries which are under pressure. So it is where the filtration takes place. So when the glomerulus is infected, the kidneys are not going to work or to function very well. So acute glomerulonephritis is an intrarenal cause of acute kidney injury. Then we have ischemia. Ischemia is when cells die due to lack of blood and therefore lack of oxygen. Remember, blood supplies oxygen to the various cells of the kidneys. So when the kidneys lack blood, when they lack the oxygen, they die, and this is referred to as ischemia. So ischemia is an intrarenal cause of acute kidney injury. Then we also have nephrotoxins. We have just talked about nephrotoxin. Remember the aminoglycoside antibiotics. Remember the amphotericin B antifungals, and even the contrast dye. These are nephrotoxins that physically damage our kidneys and even the nephron. And then we have hemoglobin. This is hemoglobin resulting from the damaged red blood cells. And then myoglobin is normally released when our muscles are damaged. So when these two compounds are released into the blood, they may go into the kidneys and obstruct the capillaries within the kidneys, and therefore they obstruct or they interfere with blood perfusion to the kidneys. So myoglobin and hemoglobin could cause intrarenal acute kidney injury. Then we have the post-renal causes. Post-renal causes are those that are after the kidney, and these causes normally cause obstruction in the lower urinary tract. When we have obstruction in the lower urinary tract, urine refluxes back to the kidneys to cause injury. There is a reflux of urine back into the ureters and then into the kidney to cause injury. So those conditions that cause obstruction in the lower urinary tract are the one referred to as the post-renal causes. And a very good example, BPH. BPH is an enlarged prostate. When we have an enlarged prostate, it interferes with the urine from the bladder through the urethra. So this causes the urine to back up into the ureters and back to the kidneys to cause acute kidney injury. Then we have got kidney stone. Kidney stones could just lodge somewhere in the lower urinary tract, in the ureters, in the bladder, or even in the urethra. When it does that, it blocks the urine. The urine will back up into the ureters and into the kidney to cause injury. And then we have got tumors. We may have various tumors or cancerous tumors, either in the urethra or in the bladder or in the ureters. These tumors could actually interfere with urine flow and cause a backup of urine back to our kidneys to cause acute kidney injury. So the causes of acute kidney injury are either prerenal, intrarenal, or post-renal. So that brings us to the end of this introductory video on renal failure. So as always, please drop a comment, like this video, share this video, and if you are not a subscriber, I urge you to subscribe to this channel. From me here today, it is a goodbye.